Hi, I got a question for you. What does pain management look like to you? Do you have a strategy when pain sets in? Do you listen to your body? Do you reflect on some of the things that maybe you're doing that maybe you could help your situation later if you just kind of honed in on what it is that's hurting and maybe what you can do differently? I'm going to talk about how I consistently manage my hip OA pain and doing so without any pain medication, pills, or injections. It's a daily approach. I basically have 10 things that I do every single day. They're constantly on my mind, and I'm going to share them with you today. I'm Shaunalee. Welcome to my channel. That really is my favorite place in the entire world. I had to close it up over the weekend. I guess I get to wait till spring to be able to enjoy it out there again, but it was getting a little bit chilly. Anyway, let's get into it. My strategy for pain management is simple. I don't want any pain. I do whatever I can do today in order to be able to directly impact how I feel tomorrow. And from my understanding, the hip gets its nutrition from movement and from fluid. So I really wanted to make sure that I took all the components that would help that into consideration. First of all, I've told you already that I don't take any drugs or any pain medications or anything like that. Instead, I use turmeric, I use ginger, I use omega-3s. I make some pork jelly. I find that very effective. I probably only use it every maybe couple of months. I make it out of pork feet and I make it out of pork tail. I cook it all down so I get all the collagen. And I probably take a couple of tablespoons of that per day when I'm taking it. And like I said, every other month or so. I also make my own bone broth from chicken. I had some earlier today, actually. I find that that's really helpful for your collagen production. At least that's what they tell me. I really felt like I had to understand what was really good for my hip joint. The hip joint basically gets its nutrition through the synovial fluid, which is a super filtrated blood. So then in my mind, I have to make sure that I'm giving it what it needs. And that would mean make sure I'm drinking lots of fluid. I get between 40 to 65 ounces a day. I should probably get 65, most of the time. I do drink that with water and some electrolytes and things like that. I do drink some tea. But turmeric, ginger, omega-3 are the big things that I take, and I take them on a daily basis. As I said, I drink a lot of water. My next strategy would be to make sure that I'm constantly moving. Again, your hip joint gets nutrition through movement, so I want to make sure that I'm getting as much movement as I possibly can. And that takes into account when I'm sitting, when I'm in the car, when I'm resting, if I'm at the office, even if I'm standing, I'm moving. I'm moving around. I never sit still. People probably think I fidget all the time. And basically that's all I do. I fidget my leg. I move my leg back and forth. I kind of do some bent knee fallouts. I do mini squats if I'm standing. I have the little floor sliders. I move my leg around in circles. I have a stationary bike. I stationary bike for 10 minutes every night before I go to bed and about 10 minutes in the morning to make sure that I give enough movement in my hip and hopefully will help me heal. I do some distractions with my hip. I put a weight on my ankle and I stand on a stool and I dangle my hip back and forth. It really feels good that way. I find that that's very helpful if I was doing a lot of walking that day. There's a little bit more movement going inside, and I find that to be very effective. Anytime that I have pain, I kind of stop and I think about it, and I do some kind of an isometric on my leg. So say for instance, if it was hurting right now, I'd probably stand and push my leg into the back of a wall and just kind of do a little isometric. Gives a little bit of a hamstring. It helps with the hamstring a little bit. I find that that's helpful. The one thing I think that's the most effective is the consistent exercise. And I probably exercise about an hour, maybe 45 minutes to an hour a day, depending on the day. And then on the weekends, I maybe do a little bit more because I do some more walking. I have a little bit more time. But I find that out of everything that I do, The movement and the exercises are the biggest thing. And how many times have you been sitting still and you get up and you've got that ache in your body? Like, I don't have the stiffness when I get up in the morning anymore. My stiffness comes a little bit later because I think I have a little bit more tendonitis things going on too. So that could be it. I find if you do the consistent exercising, it really makes the difference. If I miss a couple of days, I can really tell. I really have to be vigilant. I do a body tap and slap routine to get a little bit more movement and some more blood flow in your lymph. There's a gentleman that I watched about body tap and slap routine. He calls it the Big Six. I'll put a link for that channel down below. I don't remember his name, but I do remember the channel. Because I'm so worried about the inflammation and I'm worried about what I'm eating, I'm really strict with my diet. And that means that I only eat foods that are basically one ingredient, right? So I'm not having any carbs. I'm not having any booze. I love red wine and I haven't drank red wine for a very long time. I'm very committed to trying to resolve this issue. I wanted to make sure that I was doing everything I could possibly do to stop it. And the big thing is no sugar. Sugar's a killer. Sugar, it creates all kinds of inflammation. And since I stopped the sugar, I really noticed a huge difference. I know it's difficult to do, but after you've done it for a while, I'm going on, what, year and a half of really making sure that I'm eating properly. And I've noticed a big difference. The next thing that I would encourage anybody to get would be to get a hot tub, if you have the means to do it. Because I bought a hot tub about a year ago, and since I purchased it, I use it about 4 times a week, and I find it very helpful. It's very soothing. It, again, it gets the blood flowing in your system. I do some exercises in the hot tub as well. I know not everybody can get one. I bought mine secondhand. A heating pad works wonders. It's so soothing. If you have a sore back or if you have the top of your hip is sore, I'm telling you, it is very effective. If you don't already use it already, that's basically a big part of my pain management. But I know this might be a little bit over the top for some people, but I rest 12 hours a day. I don't sleep 12 hours a day, but I make sure that I'm laying down, resting my leg for 12 hours a day. It's still moving, but I don't have any pressure on my leg. And I stopped sleeping with a pillow. I sleep flat on my back, like straight, flat. And since I've done that, I really noticed a huge difference in my hip pain. Like I don't wake up with any stiffness in the morning. And if I'm going to use a pillow, it's basically sometimes between my legs if I happen to want to lay on my side. But for the most part, I lay flat, straight, no pillow. And I find that to be very effective. You should try it, unless you have some kind of like some kind of condition that makes you need to stay up. I find that sleeping with no pillow is very effective. So that's about it. This rehab is constantly on my mind. My goal is to make sure that I go throughout the day and not have any pain. And if I feel some pain, I sit back and I reflect on what it was, and I the next day I maybe don't do as much. The next day, I really make sure, okay, well, I'm gonna stand up some more. I'm gonna sit some more. I'm gonna walk some more. I kind of adjust every single day. But for the most part, the core things are these: the turmeric, ginger, omega-3s, constantly moving, making sure you get a lot of water, making sure that you're doing consistent exercises every single day. I do body tapping. I do some distractions for my hip. Make sure I get a lot of rest. I ride my bike 10 minutes in the morning, 10 minutes at night, my stationary bike, to make sure I get the movement in there. And I don't sleep with a pillow. I don't eat any sugar. I don't drink any booze. I really take care to make sure that I'm thinking about my diet and my overall health every single day. So I know that was a mouthful. If this channel is something that you're still interested in, if you've made it this far, I really appreciate you watching. Subscribe, follow along. Like I said, let's see how this thing plays out. I hope it doesn't become a mini-series. My next video is going to be about what happens when you have a setback. I had a bit of a setback a couple of weeks ago, and I'll tell you what I did for that. Thanks for watching. We'll see you on the next one.